Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Actinomyces species. Actinomyces are commonly found in the oral cavity, gastrointestinal tract, and female genital tract. This is a fairly uncommon infection, but it is more frequent in areas with limited healthcare access. Risk factors for infection include dental procedures, poor oral hygiene, and immunocompromised states. Actinomyces are gram-positive, non-spore-forming filamentous bacteria. They are actually part of the body's normal microbiota. They can invade tissues following mucosal damage, for example in dental procedures, however. They may complicate intrauterine contraceptive device implantation and can also lead to abscesses with potential fistulae and granulomatous reactions, as well as dissemination to other organs. The clinical manifestations of actinomyces depends on the region that is affected. So cervicofacial actinomyces comprises swelling, abscesses and draining sinus tracts on the face or neck area, and this is associated with poor oral hygiene and dental procedures. Thoracic actinomycosis leads to chest pain, fever and a productive cough. Abdominal actinomycosis leads to abdominal pain, weight loss and fever, and can be associated with appendicitis or gastrointestinal surgery. Finally, pelvic actinomycosis is associated with pelvic pain and abnormal vaginal discharge. This is associated with intrauterine devices or pelvic surgery. The management of actinomycosis involves penicillin as the treatment of choice, although doxycycline and clindamycin may be used if the patient is penicillin allergic. In addition to this, abscesses and fistulae may require drainage, and patients should be regularly evaluated for complications of their infection. Actinomycosis can be prevented through good oral hygiene and regular dental visits, and careful assessment and consideration should be taken before an IUD is inserted or a person is considered for abdominal or pelvic surgery. Okay, let's try a question. So which of the following is a characteristic diagnostic finding for actinomycosis? Our options are positive antinuclear antibody test, detection of sulfur granules in the tissue biopsy, presence of acid-fast bacilli on sputum smear, elevated erythrocyte sedimentation rate, or a positive rapid antigen test. So this is not actually something that we covered in our presentation, but maybe something that you are, in fact, tested on in MRCP. So the correct answer here is B, the detection of sulfur or yellow-like granules in the tissue biopsy. If we just run through the other answers, A is incorrect because this infection is not associated with antinuclear antibody or ANA. You'll recall from our previous series that ANA is associated with autoimmune conditions such as lupus. If we look at option C, this infection is not associated with acid-fast bacilli on sputum smear. This is more classically associated with tuberculosis. While you may see an elevated ESR, this is not specific to actinomycosis, so D is incorrect. And a positive rapid antigen test is more associated with conditions such as COVID-19, so this is also incorrect. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.